Hi everyone, my name is Ogbonna Olelewe and this is my psychopharmacology case presentation on my medication of choice, which is aripiprazole, brand name also known as Abilify. Abilify comes in different the tablets, which ranges from 2 milligrams to 30 milligrams in tablets. We will be discussing about when to use and not to use Abilify, the oral versus the long-acting intramuscular injection, which is the Abilify maintainer. A little brief description of Abilify. It's an atypical antipsychotic drug that is proposed to act via partial agonism of the dopamine D2 receptors and serotonin 5H receptors, and as an antagonist at serotonin 5H receptors. My case study one, it's a 33-year-old African American male with a history of schizophrenia, paranoid type, and insomnia, who presents to the clinic for psychiatric medication and symptom management. Patient presented alert and oriented times 3. He endorses a history of multiple relapses, multiple inpatient psychiatric hospitalization, repeated run-ins with the law, jail incarceration, and he's currently serving a 3 years probation, which is mandated by the court to report to his probation officer on a weekly basis. Patient reported a history of intermittent aggression and agitation when he's not stable on his medications. He reported he shot someone to death 15 years ago due to responding to internal stimuli, auditory hallucinations, and paranoid ideations. He served 8 years imprisonment and spent 4 years in Patton State Forensic Psychiatric Hospital under the 1370 Penal Code, which is pleaded guilty due to reason of insanity. Patient reported he has been tried on many psychotropics in the past, like Risperdal, olanzapine, Prozac, and Seroquel. He's currently taking Abilify 30 milligrams oral at night, Depakote 500 milligrams oral Q daily, and Trazodone 100 milligrams PUPRM for insomnia. He reported he has maintained stability on this medication regimens, but often forgets to take his psychotropics. He denied any side effect, adverse reaction. He denied any acute imminent psychosis, agitation, aggression, and psychiatric distress requiring acute inpatient hospitalization. He reports no issues with appetite. He denied any perceptual disturbance and no depressive cognitions. Noted. Patient denied paranoid ideation, suicidal ideations, homicidal ideation, intent, and no plan. Since he has proven tolerability and effectiveness on oral Abilify 30 milligrams, but continue to miss doses intermittently due to forgetfulness, as he reported, I will switch him to Abilify maintainer 400 milligrams intramuscular once every month to prevent relapse. The appropriate use of Abilify maintainer, since the patient has proven tolerance and effectiveness with the oral Abilify 30 milligrams without any adverse reactions and side effects, it's only wise to switch the patient over to the long-acting form of Abilify due to history of relapses and unintentional non-adherence, which he indicated. The patient must have been stabilized on 10, 15, or 30 milligrams of the oral Abilify greater than 30 days before initiating the patient to long-acting intramuscular, and he must have continued with the oral for 14 days after initiating the long-acting intramuscular. Also, the long-acting intramuscular, the monthly injection interval is very attractive to some patients who prefer fewer injections. Abilify long-acting intramuscular injection appears to be both weight neutral and lacking metabolic side effects. Simple constitution with sterile water and no requirement to refrigerate makes storage and administration easier. Decrease in relapse rate compared with oral antipsychotic treatment in outpatient with schizophrenia, according to Kane et al. 2012. Also, Abilify long-acting injection, it costs less than most other atypical antipsychotics. Long-acting injections. It is more favorable adverse event preferred profile, which has a lower risk of weight gain. Case number 2 is a 42-year-old Caucasian male, who is accompanied by his mother. He presents to the clinic today for management of his psychiatric illness and medication management. Psychiatric history is consistent with schizoaffective disorder, bipolar type, and anxiety disorder. He presented alert and oriented, good effect and well-groomed. Patient reported he's doing very well on current medication. He denied any side effect and adverse reaction. He's unable to state his current medication, but document and chart review indicated that patient is currently taking Abilify 15 milligrams oral Q daily, Lamictal 200 milligrams Q daily, and Lexapro 10 milligrams PUQ daily. Patient has been clinically stable on current medication regimen. He denied any recent depressive cognition and no perceptual disturbances and thoughts. He denied auditory visual hallucination, paranoid ideation, suicidal ideation, intent and no plan. He denied any history of relapses and non-adherence and missing medication doses. He reports consistency and adherence to his medication. Inappropriate use of Abilify maintainer in this patient is not actually needed because the patient does not have any issue with adherence to oral Abilify therapy. He is stable on current oral Abilify and does not want to change it. Also, the cost of the Abilify injection costs less than most other atypical antipsychotics injection, but more than the oral Abilify, and this is according to Kane 2014. Non-inferior to Abilify long-acting injection for prevention of relapse in schizophrenia. This is also according to Kane 2014. The culture and diversity is according to Agarwal et al. 2012. It's noted that minorities are more likely than other patients with schizophrenia to receive long-acting injections, antipsychotics, suggesting that their prescribers may consider them less adherent to antipsychotic prescriptions. In conclusion and lessons learned, treatment approach should be individualized. Respect patient autonomy. Every patient is in charge of their own treatment plan. Racial biases in mental health is proven to still to exist. Thank you so much. Once again, my name is Obono Lelewe, and these are the references for my presentation.